Simon Amondi Ongwa. I'm the Assistant District Health Officer in charge maternal and child health, Oyam District Local Government. On behalf of the district leadership, I must say I'm pleased to have this brief session with THETA, who is one of our implementing partners to support health service delivery. This project came as a result of a project of elimination of mother-to-child transmission, which was launched none other than by the First Lady of the Republic of Uganda, Mama Janet, after children needlessly getting HIV infected. I say needlessly because there's a way we should have stopped transmitting HIV to children, because the way how they get HIV is through transmission from the mother. Before this project came on board, a number of children used to get infected, when actually we should have prevented these children from getting infected with HIV/AIDS. Worse still, once we identified these mothers who were HIV and the children to be born at risk of getting HIV, a number of them could not be coming up to take care for their testing, and therefore risks themselves more to get HIV infected. Countrywide, even within the district. And after realizing this gap, that a number of children were getting infected, not tested timely, there was now need to follow up this. And we are grateful and glad that THETA came on board to do this so that we reduce the transmission of HIV to children. And I like the approach because this was now, the mothers were in community, the clients were in community, service area provisions are in the community, and therefore the approach was holistic. The approach was holistic, that involved everybody. It was actually a bottom-up system that strengthened, that aimed to strengthen follow-up of HIV-positive mothers that could see us having less children being infected, having more of our children to come for follow-up, so that we see HIV-free generation. The peer mothers are trained and supported so that they can allow the pregnant women come to attend antenatal fully, come to deliver in a health facility. If the few who are HIV positive are identified, they immediately started on treatment. And starting somebody on treatment, which was the core for EMTCT, that means we're actually reducing chances of children getting infected. And that's the ultimate goal of EMTCT, which THETA is working together with the district to make sure every mother is tested, every mother is delivered in the health facility, every chance is given that one mother, exposed child, to be followed up until he is followed to get zero infected. And we have seen tremendous improvement. In our recent M&E report, which we actually shared on the quarterly performance review, which was done last Tuesday, we saw tremendous improvements in all the sub-counties, how the number of follow-up have increased, how the mothers have been followed up, how the peer mothers have increasingly, to date, increased their support for follow-up, and these mothers have continuously come to the health center for services. I must overall say yes, this project has improved. And if you see our league table as a district, it is contributed by a number of these indicators. As a district, we are proud that at the national level, we are number 8 in best performing districts out of 114 districts, despite our numerous challenges. And therefore, I recommend this, that if there are projects to benefit the common man, these are what we innovate, have innovated well. This is what we need to be worked on ground. With support of IPs, we shall reach a level when we are all healthy, both for the mother, zero HIV generation, and we will be proud for the government, for the Oyam district local government, and importantly, the IPs who support us to do this. One of the key benefits is actually we have family support groups which are initiated through this project. HIV/AIDS is itself is a challenging situation, as you might know. The issues of discrimination, the issue of stigma has actually still remained. And with this structure of peer group, peer mothers, and family support group, they have dedicatedly opened up. They have been supported to remain positive, which is actually one of the benefits for this society, for this mother. Accepting herself and accepting to take treatment, accepting to work with health workers to remain positive, accepting to start treatment so that reduction in HIV to the children is reduced minimally, and the follow-up has actually increased, that every mother who is HIV positive and has a child risked, exposed, is followed to dot so that we give a treatment. Health workers are alone, they are not enough to do this work up in the community. They augment and work together with the peer mothers and family support group to make sure each and every mother routinely comes and picks their medication, their treatment, and their art. And this is a benefit. If somebody is supported, and more importantly, this gives an exposure, this gives a holistic family care. The father is brought on book, the family is brought on book, the community is brought on stage, and therefore it becomes a community work, not an individual work. And therefore, if the whole community is involved, if the whole family is involved, then the support for this mother is enshrined and is supported to live and stay positive, both for the mother and for the child.